Hi, good afternoon, everyone. Thank you very much for having us. Um, we feel very honored to be here and to have the privilege to speak with you. And this is probably the best time to do that as you guys are celebrating the Tavistock Consulting, celebrating the 30th anniversary. Um, so we couldn't have chosen a better moment. So we are grateful for that. Um, so we're going to talk about the Chief Nursing Fellowship Program, the Chief Nurse Fellowship Program, which is a really amazing piece of work that we talk about joint working and partnership working. And the work that CNWL and the Tavistock Consulting have done over the last 4 years is exactly that. Um, and I guess this is the point where I go back to some of my predecessors who thought of this program. And I must mention their names because they will kill me if I don't. So, former Chief Nurse Maria O'Brien, Helen Willets, who was our acting Chief Nurse up until recently, at the time when this came up, was our Director of Nursing, Kim Cox, who's still our Director of Nursing, and Louise Morton. So they recognized, and the thanking of them comes up because they recognized the disparity, but they didn't stop there. So they went a step further and tried to find out what they could do to contribute to help to that. And that's how the Chief Nurse Fellowship was born. We are now at cohort 4, which Kerry will speak of. But I think if we take it back a bit to find out how did we come to where we are? Why did they think up of this? When we look at the race data, we know what it tells us. So we know there's the representation of people from the global majority at senior levels within the NHS is shallow. There comes the pint glass. We're not having a pint yet, maybe a bit later on. But that, for me, is a representation of the NHS. If you look at the frontline staff, if you look at the cleaners, if you look at the people who serve food, if you look at the nursing, particularly within mental health, especially if you look at frontline nurses, a lot of them are from the global majority. And we creep up and you get to the top, that changes. So how is that representation fair? How do we represent the staff? How do we represent the patients that we look out for? So that tells a big story. And so what this work with Tavistock Consulting helps is to make CNWL an ideal employer to get to where they want to be in terms of getting that representation. So we've taken the lead as an organization to work on that. There will be barriers with this. We know there are. There will be barriers around internal barriers, the external barriers, looking at imposter syndrome from individuals. That we need to pull that out and find out why that is. When I speak with colleagues who don't apply for roles and they say, oh, I'll never get that job. Or the jobs are just made for white people, they're not for me. But when you speak to them, they say they don't apply. Why are you not applying for them? Because there's a fear of failure, there's a fear of incompetence, of inadequacy. And that's what we have a responsibility to address. And the Tavistock Consulting and CNW are doing exactly that. There's external barriers, the systemic biases that we know exist. When again we speak with people from the global majority who want to get to senior roles and they are at those senior roles, what they often say is, I'm working longer hours to deliver the same job that my counterparts are doing. And again, I come back to what the CNF is all about. It's working to address that. Now, probably we'll hear Kerry speak to us now about the impact that this has had in terms of what the program has brought to us.
So the Chief Nurse Fellowship Programme is a 12-month programme for 3 nurses. They are generally Band 7, Band 8A level, and they have 2 days a week, ring-fence time, where they can really concentrate on their development. And these are the elements of the programmes. We've got the Tavistock Consulting component, which is the individual coaching, joint coaching sessions and a development programme. And then within CNWL, each Chief Nurse Fellow meets with our Chief Nurse once every 6 weeks on a one-to-one basis. They have a Director of Nursing that mentors them throughout the whole programme. And it's that senior sponsorship that is absolutely crucial it's a crucial element, and it's why this programme is successful as well, we feel. They get a chance to sit in and observe executive meetings, board meetings. They get time to shadow leaders across the whole organisation. They have a buddy from a previous cohort of the programme. Throughout the year, they have to complete an improvement project, and they receive academic support through the clinical education team and through our library service. And they also have the privilege of working with me and Percy. We see them through the whole 12 months. We make sure that all the elements all come together, and that we're doing together with Tavistock Consulting exactly what they need to do for their development. So this is just some examples of some of the projects that some of our Chief Nurse Fellows have done to date. And what we're trying to do, what we're really focusing on this year, is the alumni, so those that have already gone through the programme, to ensure that some of these projects really come into fruition. 12 months, it's quite limited, isn't it, to what they can actually achieve. So what we now want them to do is to take that forward and really, really progress with some of these projects. But they've been really interesting, haven't they? It's really good to hear about them all. In terms of the impact, as Percy said, we're on the 4th cohort now, so we've had 9 fellows go through the programme. 7 of them have all been promoted, some of them twice. The 2 that haven't been promoted, they haven't gone for promotion because it hasn't fitted in with them for various reasons. One fellow is completing her PhD. She's already published 6 articles to date. One is now a nurse consultant. And we've had quite a lot of interest across the trust for new fellowship programmes. So the medical team are looking to look at how they can develop something for their doctors. And we've just launched a Chief Operating Officer fellowship as well. In terms of the impact, obviously we talked about the impact on them professionally and supporting them getting to leadership roles. But at the end of the programme, they have to do, we have a big celebration event where they bring their friends and family, and we have lots of leaders across the trust, don't we, come and listen to them talking about their journey. And we really want them to talk about the impact on them professionally, personally, but also the impact on their colleagues. And this is something that always strikes us, isn't it? So here they often say they're quite surprised by the impact that it has on their colleagues, them seeing them going through this programme and saying, oh, if you can do that, then maybe I can too. And there's just some of the quotes. Oh, I think the last one was, then it's moving over to you.
Yeah. I think so thinking about why has this been such a success, I think it's that partnership working. I think it's we wouldn't have, as a trust, we've got loads of initiatives that we run within CNWL. But what has enabled us to push this through is that partnership working. But also more importantly is the buy-in from our own trusts to have senior people from the exec level supporting the fellows. I think what that has created is it's created almost a sense of belonging, and everyone talks about the Chief Nurse Fellow. I do laugh in terms of, because this is just a small part. So the Chief Nurse Fellow is a tiny, tiny, tiny drop in the ocean. What we want to try and do is to make it a systemic change so that it goes through, and part of what will make that happen is 3 of our previous fellows have moved on to other organizations. So that ripple effect will hopefully carry on. Our Chief Operating Officer asked to meet with us last year because he's bought into this. And he's now set up, which should be starting. I think they're going through the recruitment process in the next few weeks. And they're taking the exact model. So hopefully we're creating some momentum around addressing the disparity that we've talked about earlier. And it's not a competition, it's partnership working. And I think the moral of the story, I guess, is what happens when, shall I call them, 2 big giants work together? The impact is real. And that's what we want to try and create with the fellowship program. So thank you very much.